Welcome to MD Source, helping you become a more informed you when it comes to your health. With a mission to share the most accurate and up-to-date medical advice and tips for healthy living, MD Source has conversations with real doctors and medical professionals who are the experts on the topics you want to know about. Today, Dr. Rohrich speaks with Dr. Erez about lipedema and how many physicians across the United States may in fact be treating it wrong. And now, here's Dr. Rohrich with his special guest, Dr. Erez.
Hi, this is Rod Rohrich again from MD Source. We're making sure that you are a better informed you each and every day about your health care, and we're very happy today to have Dr. Erez with us, who's an expert in plastic surgery, and he's going to tell a little bit about his background, and then we're going to begin our podcast. So Erez?
Well, thank you for having me, Dr. Rohrich. It's really an honor to be here. In terms of my background, I trained in general surgery first, and that was in New York City at the Mount Sinai healthcare system. When I was there, I got to work with leading experts in areas of lymphedema, and it really got me interested in diseases that affect millions of people, tens of millions of people, that we don't know too much about, we don't have good ways to diagnose, we don't have good treatment options. And that really led me to doing some of the seminal works and writing a book on lymphedema. From there was an interrelationship between lymphedema and fat disorders. It's called lipolymphedema. And then I began looking into lipedema, which is correlated, but is a fat dystrophy disorder where people accumulate fat in different areas of their body. It can be very debilitating and painful. I went on to train at the Harvard Plastic Surgery Program, and when I was at Massachusetts General Hospital, I worked with some leading experts in migraine surgery, which is an area that is really rapidly evolving treatment option for tens of millions of people who suffer from migraines. And I really witnessed firsthand how that helps patients. So I became very interested in that. And we actually are just finishing up a book in that area, really to educate patients. And I think my interest and MD Source's interest is very well aligned in terms of educating the patient, because really the patient has to be their own advocate in today's world.
Absolutely. And Erez, we salute you for actually advancing everything you're doing and touching. I think that's great because, as you know, it's all about focus and passion. If you really want to be the best of the best, you have to be focused, you have to be passionate about it, and you certainly have all those and more. So Erez, tell us about what is lipedema, and how does that differ from lymphedema, and how does it differ from just lipodystrophy?
Mm-hmm. So it's a great question. Lipedema actually is something I knew nothing about. We don't learn about it in medical school. It's not part of our textbook.
Right.
You'd be hard-pressed to even find it in any of the medical literature. And I came across it because I was really digging deep into lymphatic disorders. And what I found was a paper that basically showed a correlation between lymphatic disorders and obesity. And what the paper showed is that if you're morbidly obese, there's a very high percentage of those patients that have a lymphatic disruption.
So in their extremities, or mainly lower?
Primarily in their extremities, but also in their torso area. It mainly affects the extremities because that's kind of the farthest point from your core, and that's what you feel being heaviest.
Right.
Looking at lipedema was very interesting to me because it seems to affect many people. Foldy and Foldy have put a number of 11% on it, 11% incidence, particularly in women. And that correlates to about 20 million women in the United States. I became friends with Catherine Seo, who is really a major patient advocate. She runs Lipedema Simplified, the Lipedema Project. And it's really a worldwide network of patients that suffer from lipedema. So we worked together. She was in Boston too, serendipitously at the time. And we worked together on it, and we put together a book with really the world experts on lipedema.
So where is this book? This is available on Amazon?
Yep, so the book is called Lipedema, the Disease They Call Fat. It's on Amazon, and it's available as an ebook, an Audible book, as well as a hard copy. And really the goal of it is to give, is for patients as well as their primary care physicians to look at it, see what's the etiology of lipedema, how is it diagnosed, how does it differ from lymphedema, what are the treatment options, and just educating patients, because most doctors don't know about it, and many patients may suffer from it and are not being treated appropriately. We actually had the first International Lipedema Symposium in New York. I believe that was in 2014, back when I was in New York, which was very well attended, and we're just trying to bring a lot of awareness to this area.
So Erez, tell us, how does lipedema differ then from just obesity? I mean, I still am not clear about that.
So part of the problem with lipedema and defining it is that about 50% of people that suffer from lipedema also have obesity. Okay. So, these are both areas that appear to be very interrelated in terms of, obesity obviously is very prevalent, big problem in the United States, but lipedema is actually different. And part of the reason that we know it's different is because those accumulations of fat are distributed very differently than obesity, and also very differently than swelling from lymphedema.
So how do they differ?
So basically, for a patient that has lipedema, typically, and you can imagine you've seen these patients, just walking around. They may not even realize they have lipedema. But for example, if you see a patient with a narrow torso but just disproportionately enlarged lower extremities, and that enlargement really does not affect their ankles or their feet, that's classic for lipedema. When you try to correlate that to obesity is different because their ankles and their feet are similarly, the obesity just kind of spreads evenly. The other thing is lipedema, you can't, diet and exercise does not really work on lipedema. A lot of these patients have exercised, they're on, ketogenic diets, they're trying all kinds of different things, and it doesn't really work the same way.
That's that other 50%. So truly,
correct.
They're otherwise healthy, not even obese, but they just can't lose that lower extremity, which is actually not that uncommon. Not uncommon,
and really the incidence of obesity and the incidence of lipedema overlap in such a way that it makes it difficult to isolate patients with lipedema, and that's why we wrote the book, because a lot of times these patients go to their primary care doctor and they say, lose weight. This is a weight issue. But lipedema, first of all, it's painful. It has a major effect on your quality of life in terms of ambulating, and the treatment options currently are really excisional in terms of liposuction.
So diet does not work if you have a diagnosis of lipedema?
Correct.
Even without obesity, diet does not work?
That's right. Diet, it's resistant.
That's an epiphany.
Yes, it's resistant to diet, and that's been shown by groups in the Netherlands and in Sweden. Really, the major treatment option available at this point is really surgical in terms of liposuction.
Liposuction.
Yes.
So you have the diagnosis, and it's made by a clinician that actually knows the difference.
Correct.
This is a very important thing for the consumer to understand. So, because I'm sure many have been to their primary care doctor and said, well, obviously you have excess weight in your lower extremities and you should diet, and it doesn't work. So where do they go to get the right diagnosis and treatment? Tell us about that.
So the first thing is you have to go to a place that's aware of lipedema. There are a number of different places in the United States, and it doesn't actually even have to be a doctor that knows about lipedema specifically. A lot of the doctors that treat lymphedema are aware of lipedema. Part of diagnosing lipedema is almost a diagnosis of exclusion, meaning that you have a swollen extremity, and you have to look at other potential causes of a swollen extremity and eliminate those. So for example, part of the differential diagnosis may be a lymphatic disorder. It may be a swelling related to a venous occlusion. One of the veins is blocked off, causing swelling.
So these are kind of diagnoses of exclusion.
Correct.
And then are there any other diagnostic tests?
Yes, there are. So many times these patients will have, in certain cases, will have an MRI, or an MRA actually, that will look at the fluid content versus fat content. You can do different volumetric studies to see how the extremity changes over time.
So what kind of doctor do you see to get this type of diagnosis?
So that's part of the challenge. Part of the challenge is patients just really feel like they don't know where to go. They don't know who should see them, and oftentimes this starts at the primary care level. And
they have no clue.
They don't know. And Matt Carmody, who is a physician, a primary care physician in the Harvard Medical School system, helped us write this book primarily for primary care physicians too.
Right.
Because we want patients, and this is happening. I mean, patients are taking the book. They're saying, listen, this is how I feel. This is what I look like, and this is what the book says is lipedema. What do you think about it? And at least that triggers a referral or some kind of forward motion into different imaging modalities to try to pin down what the problem is, because otherwise it just
to find a true expert. Because honestly, we need that for plastic surgery too.
Yeah.
Because not many plastic surgeons really know this difference, and
exactly.
I think that. And as I'm going to ask you in a minute, I mean, what are the treatment options for this? So you've made the diagnosis, you've found somebody that's going to do these tests. So what are your options?
So currently, there are different types of liposuction that are done to remove the fat cells. There's a debate over which liposuction techniques are best. Some people use water-assisted liposuction. Some people use, kind of standard liposuction under a super wet or tumescent technique, we call it. As we know, liposuction does not damage lymphatic channels and functions to remove the fat cells. That's the primary treatment option currently available. Probably many plastic surgeons are treating lipedema without knowing that it is lipedema.
They're just doing liposuction.
They're just doing liposuction.
Extremity liposuction. So,
Right.
so is one type of liposuction for this disease better than others? I noticed you mentioned, so traditional liposuction with just putting in wetting solution and taking it out, and then there's ultrasound, there's power assisted. Is one better than the other for lipedema?
It's a great question. It hasn't been shown yet, so we can't really speak to what's better than another. I could say that typically tumescent liposuction is used.
Tell the audience what tumescent,
Sure.
or is it really, it's kind of a super, tell us what
Right.
does that mean?
So essentially what it involves is injecting a solution into the fatty tissue that has a local anesthetic agent, typically called lidocaine, and also has a little bit of epinephrine in it, which serves to constrict the blood vessels so that when the fat cells are sucked out through the liposuction technique, it's very clean fat. It's a relatively blood-free, bleeding-free kind of environment, and it serves for a very safe removal of fat. Typically a day surgery, and it's very safe.
Right, and it's really liposuction.
Yep.
So it's safe
Commonly
liposuction.
done, exactly.
Yeah, it's liposuction done where there's minimal blood loss. And
Right.
So that works fairly effectively?
It's very effective. It's currently the only effective treatment for lipedema. And part of the reason to bring awareness to this condition is many advocates for lipedema patients are lobbying for coverage under insurance, because otherwise it can be extremely costly for patients to treat this condition through aesthetic routes.
Right. Well, I think the biggest epiphany for me is that this type of subcategory of lipodystrophy or lipedema is diet and exercise resistant, because we're always taught as physicians and even in plastic surgeons that, okay, you have to diet, you have to exercise, you have to get in within 10% of your body weight, then we'll do liposuction on
Right.
you. But this is different. If you have this diagnosis, it's
not
diet
gonna-
and exercise resistant, so you really need to exercise. And actually, do you see this more often in younger people? Because it's not infrequent. I see this in younger patients, teenagers. So this may be an indication for doing liposuction in a teenager.
Exactly. There's actually been correlations, although weak scientific correlations, but there has been a correlation with hormonal effects. So, for example, entering puberty may trigger, and we know that there are certain receptors on fat cells that are become activated with estrogen levels. So that's been shown. So there's some correlation between hormone levels and lipedema.
So if this is a disease process that's obviously in evolution, and the treatment is liposuction, what's the long-term effect? Because we know with regular liposuction, if you do liposuction and they continue to diet and exercise, that actually it's a good permanent cure. How is it with lipedema?
So similar to regular liposuction, those fat cells are removed and they don't come back. That doesn't mean that other fat cells in other areas of the body can enlarge, but typically that disease process is isolated, from what it seems, to those areas that were primarily affected. So if you liposuction someone's extremities, someone who suffers from lower extremity lipedema, they should not develop that disease all of a sudden in the upper extremity.
If they're doing all these other
correct.
things.
So it should treat that.
So it's primarily in the trunk and lower extremity. Do you ever see lipedema in the arms?
Yes, absolutely. Primarily in the lower extremity trunk, but it can also be seen in the arms. And similarly, it will spare the wrist and hand. So you'll see someone with a disproportionately enlarged...
And who's not obese.
Correct.
Really?
They a large percentage of them can have obesity, but you don't have to be obese. You could just have a disproportionately enlarged upper extremity that spares your wrist and hand.
Okay. And one other question before I'm going to ask you to sum up. So what about the patient, the massive weight loss patient, the one that's had the gastric bypass or some type of surgical procedure for weight loss? How do they respond? I mean, what are the treatment options for them? Obviously, we wait about a year before we go and operate on them. Many of those are excisional.
Right.
Do these patients have a lot of extra fat that does not go away?
It's similar, actually. So believe it or not, once you have a bypass or some kind of sleeve gastrectomy, if you previously had lipedema, you are likely to still have that disproportionate accumulation of fat.
And I've seen that in some patients.
Yeah.
And honestly, I would scratch my head because saying you've lost 100 pounds and you still have these robust, thighs and arms, and you still
Right.
so. I just thought there were these non-deflation massive weight loss patients. So these patients then actually have lipedema.
I believe so.
Wow.
There's still a
That's
lot to be
amazing.
learned in this area, and part of the reason we did this book was really just to bring awareness, just to trigger more research and looking into this. But there's a lot that we don't know about fat, and we're learning actively that fat is not an inert substance. It's a hormone system. It's an organ system actually that responds to hormones, and it's much more sophisticated a system than we thought.
Well, I think this book isn't just for consumers. I think it's for all the rest of us
Yes.
too. I think it's
Yes.
for primary care and for plastic surgeons, because this is a new entity that I think, honestly, we probably have been telling our patients for decades and decades. These poor patients, and saying to them, diet and exercise, and yet they can't.
Right.
And it's diet and exercise resistance. So what an epiphany type of information, Erez. So I congratulate you and your team
Thank
for
you.
doing this and publishing this on Amazon. Tell us again how you can get this on Amazon.
So if you just Google lipedema on Amazon, there's this is the primary book there. It's published by the Lipedema Project, and really there's a list of authors that are experts from Stanford, Harvard, the Netherlands, Germany. Really, we got together everybody that knows who's who in lipedema on this book to really put together an authoritative source for primary care physicians and patients.
Wow, amazing. The eye only sees what the mind knows, and
That's right.
certainly here we certainly didn't know a lot.
Yes.
And I think this is, again, really, kind of accentuates the need for a true Dr. Google, an MD source that kind of brings out the truth about, certainly in this case, lipodystrophy of the trunk. I mean, sometimes it's not what it may appear to be.
Exactly, and it's like they say, if all you have is a hammer, everything looks like a nail.
A nail, right? And honestly, I feel bad because for a long time we've been telling patients go lose the weight when it didn't affect it, and they really weren't obese.
Exactly.
And so I think this is really very useful for the consumer. So know before you go. Be your best advocate. Listen to MD Source. Thanks again, Erez.
Thank you.
From the team at MD Source, here's to good health and to helping you become a more informed you. For the latest and most up-to-date information on health topics, visit mdsource.com. Drop us a line, sign up for our newsletter, and connect with us at mdsource.com.